how do we get our hair to grow? And what is hair regrowth? Well, there's different ways of looking at this. And number one is, what we want to do with our real existing natural hair is for it to regrow and get a lot more than what we have. And that's what we call hair regrowth. Now, can we stimulate that naturally? There's nothing that we can really do to stimulate your own hair regrowth once it's slowly going away through the genetic aspects of male pattern or female pattern genetic hair loss. But there are treatments available to regrow your hair and to get the hair regrowth that you want. Number one, FDA approved minoxidil, which is sold under the name of Rogaine, is a product or a liquid that you rub onto your scalp that can increase your hair regrowth and stabilize the hairs that you have. Number two, a medication, Propecia or finasteride, is a pill that is given to men, and in some cases it's used off-label in women that are not of childbearing potential, and it can actually also increase your hair regrowth and stabilize the hairs that you have so you don't continue to lose hairs over time. Now, there's other things that have been used for hair regrowth, especially in women, off-label. Doctors have used a product called spironolactone, which is an androgen inhibitor, and this is shown in some clinical studies to actually regrow hair and to improve the quality of the hair. We also use laser caps or low-level laser treatments. This is something that has been used in terms of trying to nourish the hair follicles in some way to try to improve the quality of the hair as it exists, today. And there's experimental procedures that doctors are doing that we're looking into, such as platelet-rich plasma, where we take your blood out, we spin it down to the platelets, platelet-rich, and we re-inject it back into the scalp in an effort to try to re-stimulate hair growth. The studies are very new. The results are promising and encouraging, but it's not a panacea, it's not a cure-all, and I don't like to tell my patients that we're going to create a ton of hair follicles from PRP, because that's just not the case. But it is a treatment that, in my opinion, has some merit and some value, but I like to be straightforward and honest with people, and I don't like to sell it like it's going to grow a ton of hair.